I do believe it has to, continue to be up to individuals. I did not support the bill on mandatory vaccinations for kids. I think it's government overreach. I think people got to make their own personal choice to their own medical and healthcare issues. But I've also said in relation to the 75% target, government needs to be flexible with that. And the reason I say that is the vaccines are effective. They've been proven to be effective. When you do get breakthrough cases where some people that have received vaccinations still catch COVID, the vast majority of those are asymptomatic. They have no symptoms at all. Other ones that do have symptoms are mild in nature. We've done well at protecting our most vulnerable, which has been a goal. But the original goal of these restrictions and emergency mandatory order was, again, flatten the curve so our healthcare system doesn't get overwhelmed. We saw an outbreak in Fredericton where we saw dozens of people infected. We're seeing numbers are still there on a daily basis, yet the hospitalizations are declining. I think at this point we have to stand back and look at the data, be objective about this, and say, are we at risk of our healthcare system being overrun if we don't hit 75% to change the restrictions in June? And I don't believe we are. I think what we need to do is be flexible with that 75% number and allow more freedom for New Brunswickers. They've earned it. I have been pushing for about the last 2 months in the legislature and publicly and in these COVID meetings for government to create a reopening plan. So I was pleased to see that government moved on that and created this plan, June 7th, July 1st, and then August 1st. But my only drawback to that is, again, I don't want government to be so rigid on these targets that we're allowing emotion and this continued fear to override the data that is in front of us, and the fact that, again, we're sitting with a limited amount of people, and very, very small number of people in hospital right now due to COVID. So I've always said we can't have this both ways. We can't say the vaccines work on one hand, but on the other hand, we're not going to loosen restrictions. Well, which is, look at the rotational workers. Perfect example. Government said, look, you get vaccinated, we'll loosen the rules on rotational workers. Rotational workers get vaccinated, and they go right back to square one in terms of restrictions. So, we got to be objective about this. We got to take the emotion out of it. People want hope. The question I have is our vulnerable population protected? The answer is yes. Are we seeing low cases of hospitalizations despite COVID numbers continuing to be there on a daily basis? Are we seeing low numbers of hospitalizations? Yes, we are. So if that's the case, objectively, you've got to look at it and say, look, the vaccines are working. So let's be flexible with allowing people to live their normal lives as soon as possible.